Hello, I'm Reverend Neely Hicks, and welcome to the Women Arise podcast. Today's episode is interesting and very informative and inspiring, and it is brought to you through the National Association of State Mental Health Program Directors. This is the first in a three-part series that is focused on the response to the Surgeon General's recent report on the epidemic of isolation and loneliness in the United States. In this episode, we will be talking about how faith-based communities are responding. Listen and engage with us on social media. Also, please subscribe to the Women Arise podcast for more episodes like this one.
Oh, hi, everybody, and welcome to what is the first of our series in town halls titled Cultivating a Culture of Connection Through Community-Designed Initiatives. Surgeon General Dr. Murthy has called for action to address the public health crisis and devastating impact of the epidemic of loneliness and isolation in the United States. Dr. Murthy also explains in his incredible paper that disconnection fundamentally affects our mental, physical, and societal, and if I could add, spiritual health. He also states in his document that loneliness and isolation increase the risk for individuals to develop mental health challenges in their lives. Through funding from SAMHSA's Transformation Transfer Initiative and through the work that NASMHPD has been doing for many years, we partnered with peer-run and community-designed initiatives to serve diverse populations, including those experiencing trauma in their daily lives and individuals struggling with serious mental health challenges. This town hall series we're excited about that will provide an opportunity for discussion and implementation of the 6 foundational pillars that are outlined in Dr. Murthy's important work. We've been talking about this for several years through our work in the trauma-informed care arena, and we knew that isolation, we knew that disconnection, we knew that this was a huge factor in people that have experienced both substance use, mental health issues, and trauma. To be able to have the Surgeon General come out and say that loneliness and isolation is a huge impact on American society just fits so beautifully into the work that we've been able to do through our funding from SAMHSA through the Transformation Technology Initiative. So our first of a series of 3 town halls, and we're going to put up our whole agendas and the dates. But the first one is on how faith communities respond. And we have some incredible speakers that will talk about what's going on in various faith organizations, how we've worked with faith organizations who are not just talking the talk, but walking the walk, who are doing things in community, everything from housing to our trauma focus groups that are going on in many different denominations. And Neely and Sharice will talk to you about that. Our second town hall will be June 26th, same time, 2:00 Eastern Standard Time. And that town hall will be about peer-led inclusive approaches designed to support, unify, and prevent isolation. And that's another diverse group that are looking at not just people who struggle with mental health, but how do we include that peer kind of support work in communities in diverse settings. The third one will be coordinating loneliness and isolation in diverse communities, and we'll be hearing from folks in indigenous communities, youth communities, folks within the LGBT communities who are really going to talk about innovation and also start the discussion on ideas that we can come up with on how we take Dr. Murthy's report and move it forward in community. We know at NASMHPD and through SAMHSA, so much of our work now is in crisis services and how to implement crisis services with the 988 and that first entree into the public health system. And we also know it takes a village. We also know that doing this kind of work and including all of these different community-based supports, we could not just serve people who are already experiencing such challenges, but really perhaps prevent it from occurring in the first place. So we thank you for joining. We're really excited about this work. And we're going to put up Dr. Murthy's report. If any of you have not read it, please do, as well as Triumph Over Trauma that Neely's going to talk to you about and the work that she's doing with us, and our agendas for the next 3 town halls. So again, thank you so much. It's great to see so many familiar faces. And we hope this will be a robust discussion after we have our presenters talk about the work that they're doing. So Neely, I'm going to turn it over to you.
Thanks so much, Joan. It's really good to be with all of you today. I'm Neely Hicks, and I'm a pastor in the United Methodist Church. The way I do ministry is a bit unique. I equip and train faith leaders in many parts of the world to prevent disease and also recover from trauma in their local communities. I'm also a pastor, one of the pastors at a local church named Glencliff United Methodist Church. And if any of you want to check that out, you can go to glencliffumc.org. And we use our land for medical respite housing on the church campus. That provides medical respite bridge housing for people who are homeless, so they don't have to recover on the streets of Nashville, but they have their own home to live in, to recover, to get the care that they need, and the community surrounding them to reduce their isolation and loneliness at perhaps one of the most difficult times of their lives. We offer recovery groups. We have on-campus gardens so that people have fresh vegetables. And we also provide foster care for animals of homeless persons who might be in the hospital or incarcerated temporarily, so that we can foster those animals and reunite them with their moms and dads. People come to the church when they are in need of community. There's a lot of isolation and loneliness out there. And I think at the core of it, like, we have social media. You can jump on social media and connect technologically with people, but we don't get that deeper connection with one another. We may have those superficial relationships, but not actually have the in-depth relationship that provides insight and where we feel seen and actually heard. But people come to the church when they are in need of community, and they leave feeling that they are not alone in their struggles. We are with them in faith and in solidarity through Love and Justice Ministries. I found the National Association of State Mental Health Programs through a Google search. So yay, Google. And I was looking for a trauma-informed peer support group model to use in communities globally, because I saw different recovery groups, but I couldn't find anything that dealt with trauma that could be peer-led. So I found them, reached out to Dr. Gillies, and began immediately working and connecting with her to extend their phenomenal resources to faith communities, which we began last year in September. Started with the Abrahamic faith traditions, Christian, Islamic, Jewish, and then also Indigenous. And we also now have Spanish-speaking curriculum. The program that faith communities are now using is called TAMAR, which stands for Trauma, Addiction, Mental Health, and Recovery. And it's part of a 30-week curriculum that NASMHPD initially built for a women's correctional facility. It's worked successfully in those for the last 2 decades and has produced really great results. But together, NASMHPD and my organization have built a new edition of TAMAR, a 7-week small group model. So it's 7 weeks. Okay, that's something that a lot of congregations use, that model in offering small groups to become trauma-informed and practice the reintegration of body, mind, and spirit. Since September of last year, we've trained faith leaders in most geographical regions of the US so that they can locally lead these 7 groups, but we are still working to expand this model in every state and US territory. We've begun online groups where people can actually participate in a group online until more cities and towns have locally led in-person groups. One of those signing up for our online group said, I want to learn more about how to process trauma and use the skills with the people I serve. Another said, I want to learn how to decrease my reactivity to trauma triggers. Another said, I would like to learn how to better support the residents in the nursing home where I work. Many good people in this world care for people in their communities, lessening isolation and loneliness, and also providing wisdom. So again, we want to work with all states and territories in distributing the curriculum and training facilitators of the groups. I hope to get your input and questions during this session. Finally, we have new upcoming resources that include a new edition of NASMHPD's TAMAR Y for community youth groups, a TAMAR supplement for LGBTQIA people, a children's TAMAR version, and a TAMAR version for deaf persons, which all will be used in faith communities. All of these resources can be found at triumphovertrauma.info, which you can see the QR code above me and the URL on the other side of me. I want to go ahead and pass it over to Sharice Wright. And just to say that Sharice is our lead trainer for Triumph Over Trauma for TAMAR. And so I'm going to pass it on to you now, Sharice.
Good afternoon. Thank you, Neely. Good afternoon, everyone. Welcome, and I'm so glad that you were able to join us today. Again, my name is Sharice Wright. I'm a social worker and a faith-based leader here in Philadelphia. I am successfully thriving in spite of the lifelong effects of my childhood trauma. My desire to support others on their journey to healing and wholeness led me to becoming a trauma consultant and doing trauma work in different capacities for the past 18 years. As human beings, we are mind, body, spirit people, and experiencing trauma can cause a disconnect in our ability to function. Understanding and applying interdependent approaches helps us offer authentic pathways to healing. The approach that I'll be sharing with you today is the Friendship Bench. Friendship Bench was founded in Zimbabwe by psychiatrist Dr. Dixon Shimbada as a safe space and a sense of belonging in communities to improve mental well-being and enhance quality of life for those living with depression and anxiety. At its inception, grandmothers sat on benches offering their time, their wisdom, their love, and training to assist and support those in need in their local communities. Since 2000, Friendship Bench Zimbabwe has worked with the World Health Organization to support WHO's special initiative for mental health. This amazing work, anchored in empathy and connection, has reimagined the delivery of evidence-based research services for those living with mental illness. Today with NASMHPD, I am proud to announce that we will begin cultivating friendship benches here in the US, with our first locations being the Maryland and Washington, D.C. area, as well as Philadelphia. In partnership with faith-based and community organizations, I will train lay leaders and community members on how to access and provide basic supportive services to individuals in low to mid-level stressful situations. We will provide our community partners with benches and training, assistance with setup, and providing ongoing support as needed. Communities will also be trained in the Triumph Over Trauma curriculum that Neely previously spoke of as an additional resource. As we recognize that healing happens in relationships, our goal is to empower communities to recognize and capitalize off of their innate peer support, reduce stigma around mental health, and increase opportunities for healing both individually and communally. Thank you. So now I'll pass it off to Pastor David.
Thank you, ma'am. I appreciate it. Thank you for the invitation and for all of you joining here today. I don't think I'll be as polished as the first two speakers, so I'm just going to share from my heart. Here we are. But great jobs, both of you. So I'm here to speak of, and I've been invited to talk to two initiatives that I helped found. One was mine, founded after my MBA was completed from Penn State University, and the other was just founded with friends of mine who were like-minded in ministry. So first I'll say, I'm a pastor in the city of Philadelphia. I serve a church in South Philly called Church of the Redeemer Baptist, but that's not the capacity I'm in today. The capacity that I serve in today is as a founder of two organizations that helped create community. First one being Winning Wealth Services. Winning Wealth was founded in 2005, very under the radar, right? It was 100% passion for me. I worked at the Vanguard Group for about 8 years. And as I was working in that organization, I realized that, and I will use this term, my people didn't have the information about finances that I was learning by being an IT professional at a financial services organization. And so what I started to do was talk with my friends and my family and do some research in this space, this financial literacy space, to just understand a little bit more about how I could learn for the benefit of sharing with others. As I was studying to complete my degree, I ran across the class action lawsuit with a large bank in the US that was at that time being settled. And the question became, what would you do? It was in an ethics class. What would you do to help this organization repair their reputation in the world that's already been damaged? We came up with an organization that would teach the basics of financial literacy. Fast forward through partnerships with the Vanguard Group, with JP Morgan Chase, with Habitat for Humanities and other organizations. Since 2005, we've helped about 10,000 people recover from or understand what it looks like to positively manage their personal finances. It's been a fabulous journey. It's been a fabulous journey. And the benefit and impact one family at a time has just been beautiful. So that's one capacity that I'm here to speak to and maybe learn from you and share a little bit more of my experience about. That's helped create community in ways that families would come to a table and talk about difficult topics, as we were able to broker those topics with and for them. But in a different area, just again, passion that created community. Four friends of mine in about 2008 founded an organization called NETSR. And NETSR, the Hebrew word, speaks to new growth out of a dead thing, right? Mm-hmm. So what we were looking at in that moment was denominational churches dying. And we were at that time, late 20s, early 30s, trying to figure out where and how we could be the change that we wanted to see in the local church. And so we went and we gathered with a bunch of friends who were either pastoring or impacting in some significant way their local congregation and or context. And we started to have conversations. What does it look like when you go into church and everyone could be your grandma, right? Like, what does it look like when you are leading a group of people, but you don't have any connection with the same? How do you feel when you're trying to figure out how to live life together with people that you have no connection with? And so what we did is through NETSR, we created cohorts, regional cohorts in and around the city of Philadelphia, from Philadelphia through Harrisburg, up to Allentown, down to I believe the last cohort is in Baltimore at present. Local cohorts where individuals who are either leading or influencing local congregations in denominational churches. I want to be specific about that. We've come together and just build community, do life, talk about challenges, figure out who is having a hard time in their marriage with their families, who is struggling financially. And how do you talk about the real things of life in a way that will allow you to still do your job, still stay connected to God, but also still be effective as a human, right? And all of those mental health balances that we found, there were times where some people needed to take a break, we were able to pray together and understand what it looked like to go on sabbatical as a pastor. We were able to think about and walk organizations, churches through the modification of their constitution for the benefit of healthy leadership still remaining in organizations. And I was even able through NETSR to work with a couple of large denominations that were going through the transition of what it looked like to be welcoming and affirming, or open and welcoming and affirming, or just fully embracing the LGBTQ plus community. And so trying to figure all of that out in life and with your job, it's just been a blessing for me to be able to be with individuals who are just walking through the struggle of making life happen in a way that it works well for us so that we can stay balanced as the people that God created us to be. So thank you for allowing me to be here. I'm grateful for it. And now I'll turn it over to Arsenio Wright.
Thank you, Pastor David. Hey, welcome. Glad to be here, guys. My name is Arsenio Wright, and I'm with the State of Tennessee Faith-Based Initiative Program here in Memphis. I'm stationed in Memphis. And one of the things that has brought me to becoming this individual is going through my own trauma, going through my own ups and downs of life. I went to the church, and the church didn't know how to handle me. They didn't know what to say to me. They didn't know, they did know what to say. They said, pray about it.
Yeah.
But it was other things that I needed to do. And now that I have taken my own life and learned from it, then now the state has put someone into the faith-based organizations, which we go into the congregations and we train people for suicide prevention. We train individuals in trauma. We train individuals in asking the question, because sometimes, asking the question, do you want to harm yourself? It's hard. And the state has decided to teach people. Not too long ago, we just did a Trauma Over Triumph here in Memphis. And I reached out to a lot of the congregations that I'm working with, and the outcome was so large and so beautiful. We had the newscast there and everyone, and from that there, people are becoming interested. They're becoming interested in how to ask that question, how to, present, what to do when they hear what they don't want to hear. And that's, yes, I want to harm myself. Or yes, I'm using drugs and I don't know how to stop. Or, I'm dealing with a mental health, because a lot of things were looked at differently through the church eyes. There's a lot of pastors that know how to preach, but does not know how to heal themselves. So, that's some of the things that the state has offered. It's 4 of us across the state of Tennessee, and we have other peers that we work with, but we actually go into the churches and we actually ask the congregation, to allow us to train someone within their church to be their resources. And we provide them all of the resources and all of the connections that they would need to be able to help someone get in the direction that they need to go. I love it. One of the things that we have coming up that's really, really big is the 10th annual National Black Suicide and the Black Churches. And it's really 20 years, but it's done every 2 years. And it's the ministers. We're trying to reach the congregations. We're trying to go into the congregations and allow the congregations to know that you don't have to suffer alone. There's elders in the churches that does not know which way to go with their grandkids, because these grandkids is doing what grandkids do. So we're trying to get into the communities, and they always tell us the way to the communities is through the churches. So now we're trying to get in the churches, and we're trying to do the best that we can to save lives. I'm glad to be here, guys.
Thank you so much, Arsenio. You know, I think you're so right when you talk about if you want to reach people, like go to the houses of worship, because I mean, that's where there are already, most of the time, long-standing connections with communities, especially if it's a small church. And I mean, this is the family that a lot of people, that's the only family that they have.
Yeah.
So Sharice and I are going to be asking some questions of our panelists, and then we want the rest of you to put your questions, and you might even want to put some answers in the chat area. But I'll go ahead and begin with the first question. So, and this is directed to our panelists, and any of you who want to respond of the panelists can in this round. Okay, so what are you doing in the community and in your community work to lessen loneliness and isolation? And I'll put the question also in the chat area. What are you doing in the community through community work to lessen loneliness and isolation?
Well, I mean, I'll answer. I'll start it off.
Okay.
To lessen loneliness and isolation is one of the things is that we're having support groups. We're doing get-togethers. You know, we're checking on each other. You know, if Anne came last week and she didn't come this week, has anybody talked to her? And we're reaching out to each other to allow them to know that we really care. You know, like I said, the suicide in the Black churches is we're knocking on doors. We're offering free registrations. We're offering free, you know, transportation. You know, we wanting to reach as many as we can. We have a youth program that's coming up. So we're trying to reach as many individuals as we can. Yeah.
Thank you, Arsenio. Pastor David.
Sure. The pandemic was really difficult, and I'm going to speak from a pastoral perspective at this point, but the pandemic was really difficult. And in that moment, it was really hard to try to figure out ways to still have community that was healthy while taking care of yourself and your congregation. So one of the things that we found were just on special days like Mother's Day, I bought a box of roses we have this thing called Produce Junction in our area. We bought a box of roses and took them to people's homes and put them in the mailbox, you know, just to let you know that you're still loved, you're cared for. We're still doing this together, even though we can't do it together. With regard to NETSR and the meetings that we had there, again, I know we're all zoomed out, but Zoom was an amazing resource with regard to just staying connected, being able to see someone's face and look in their eyes, and ask how you're doing in a way that they can't hide, because now when your camera goes off, now I know you're trying to hide from me, right? So being able to make sure that you're really connecting with an individual. But as we're coming out of that stage of these last 2 or 3 years, it's really important to try to re-engage with community in a way that for people like me who really enjoyed not having to come outside, praise Jesus, it was really hard. I'm an introvert at the core, so being able to just stay in the house was cathartic for me. And now that I have to come outside and re-engage with the rest of the world, trying to find ways to do that healthily while still remaining keeping my own battery charged is really it's a challenge at present. But it's helpful for me to know what was positive and negative when community was taken away from me. What did I enjoy? What did I not enjoy? And then teach into that and have conversation with people, with others, to say, okay, well, what was it like for you and how did it work for you? And then again, that's another opportunity where we can build community together to say, how did the pandemic impact you and how did it not? I'll say one more thing. It was really difficult to come back into a congregational setting when you realize that over the last 2.5 years, the people that you saw sitting in certain areas were never going to be there again. And you didn't have an opportunity to celebrate what the impact on their lives actually was to you. So being able to find ways to create small communities to say, hey, listen, we understand and we appreciate that grief is absolutely a part of life, and that loss was very impactful for you. So we went through a series on grieving just last year, a 6-8 week series on grieving, just to explain the process step by step, understanding that grief never ends, but just to explain the process, to give people language to what they're feeling, for the benefit of everybody, at least having a common language so that we can start to talk about things with the same words and then grow together.
Thank you, David. You know, the pandemic revealed a lot of our societal weaknesses. And I think one of them, we recognize the digital divide, because for those who are used to working on the internet, doing things online, like it could feel almost seamless to just, okay, well, now we're going to do these things online instead of in person. But in my congregation, the elderly people who were so used to showing up every week and having meals together, then it was, okay, they're feeling really extremely isolated and lonely. So how do we work with them, bring them up to speed somewhat in technology so that they're not alone? But the hardest area was helping one of our beloved members who was blind feel included, because even though she was online, she missed feeling the physical energy of being with someone. And you know, that was something that sadly she died during the pandemic, not from COVID, and it felt like it was from a broken heart. So that loneliness and isolation, yeah, it was felt so much more by some people than others. Charisse, what would you like to add?
I think some of the things that I've done, I used to work in an agency where individuals with intellectual disabilities lived when the pandemic first started. And so it was really challenging for them because they are very hands-on. And I spent a lot of time helping them and being with them during that difficult transition for them, that they weren't allowed to touch everything and touch everyone, when that was how they connected, especially being nonverbal. We had to develop different ways to communicate. So we did a lot of drawings and writing activities. And for them, even for me, I just took the risk for and would hug them when they needed a hug. We're all going to put on a mask. We're all going to wash our hands. And I would still hug. A few months back, and for me personally, a few months back, my pastor talked about getting out into our communities and connecting with people within our communities. So I recently moved to a new area, and what I've started doing is sitting out on my porch, doing gardening. And I've noticed that since I've been out there, that a lot of people stop by, they come and sit on the steps, they come and talk to me. And so it's helping to develop relationships within the community, but it's also giving space for people to come and express how they're feeling about different things that they may not have expressed to other people, because here is a face that they've never seen. So people are sometimes more willing to share stuff with people that they don't know than with people that they do. And so it's helped me to develop safe spaces with a lot of people. Yeah.
Thank you, Charisse. We've got really great comments in the chat area, so I hope you all are catching those, and a lot of affirmation also about the inclusion of LGBTQ plus in this work. And I think, you know, for all of us who are panelists, I mean, the inclusion of God's love knows no bounds. It's all of us. And people of faith are sometimes not good at sharing that. and they are more exclusionary. And to me, that's not church, that's a club. But anyway, we won't get more into that right now. Charisse, you've got the next question.
So the next question that we will pose is, how did becoming trauma-informed impact the way you understood serious mental illness in your community work? So how did becoming trauma-informed impact the way you understood serious mental illness in your community work?
I'll go first. So we had I believe it was 2018. 2018, there was a gentleman who was murdered by the police in Philadelphia. Was that an election year, a presidential election year? I believe it was. Okay, yeah. There was a gentleman who was murdered by the police in Philadelphia, and I was pastoring at the time. My work in that area was primarily just trying to figure out where and how and why. And we were chatting before we came on to, we went live with this conversation, the official conversation about the interfaith community. And one of the things that we were able to do in that moment was respond with an interfaith prayer vigil, just to speak to not racism or classism, but to speak to the misunderstanding of mental health and how it's responded to or reacted to instead of responded to. This gentleman was clearly impaired in some way. And his mom said after the fact that he had not been taking his medication, and he was he was killed by a police officer in the street in cold blood. The faith communities, the Baha'i community, the Wiccan community, the Christian community, the Muslim community, all of the faith communities through Interfaith Philadelphia came together. And for 24 hours, we stood together in solidarity for the benefit of all of us, understanding that this just has to be seen, and it has to be named. It has to be seen and named in a way that we can now finally, first of all, do the right research to understand how we should respond. And secondly, once again, we have common language and the right information behind our response, then we can have more conversation about what it looks like to experience the trauma of one having diagnosed or undiagnosed mental illness in your life, whether it is you or it's someone that you love. And then number two, how do we respond to that? But thirdly, how do we respond to the trauma of negatively impactful incidents that occur to those that we love? I mean, this mother lost her son, right? How do we do that? Like, how do we deal with that in a way that will help all of us as a community grow together for the benefit of us being seen and heard as people, right? So that it shifted my whole entire outlook. It's not just a Christian bent. It's people serving people for the benefit of us being seen and heard in a way that we can all just live together, you know?
Can I just ask Pastor David a question to follow up on that? With our discussion around isolation and loneliness, what impact do you think that had on this young man's life? And with things like we're talking about, like the friendship benches and prevention strategies, would that have made a difference?
Absolutely.
In his isolation, loneliness, and what led to the unfortunate events that happened? Absolutely.
Thank you for that. And the incidents that we named in this vigil were incidents where either this young man specifically was in his home for a long while, and he came outside to go to the store, and no one was there for at least a 24-hour period. Had there been someone that was able to go in and talk with him and share with him and maybe just sit with him, then maybe there wouldn't have been an incident to de-escalate, and maybe he'd still be alive today. Friendship benches, Charisse and I have been talking about friendship benches in Philadelphia over the last month or two, and there are parks in the city that have benches, but they're there, but they're not used or marketed in a way that will allow for gentrifying communities. And we're speaking to mental illness, but for all the people that are in the area, to be able to come together in a healthy way and see that this is a safe space for all of us to talk and live together. I really feel like togetherness is an important component of what we're trying to do for the benefit of the community being a whole community.
Yeah, a couple of weeks ago, Sharice and I had a call with a group of grandparents who want to be the ones that sit on the bench in DC in front of various different churches, and they were gung-ho. They also want to run the TAMAR groups. So we're bringing in these grandmothers to run the TAMAR groups and sit on those benches, right? And they're wonderful, right, Sharice? They were just
They were the best.
Yeah, they were like, nothing was going to bother these girls. They were out there. And we had one guy. We had one grandfather. Thank you, Dave.
Arsenio, would you respond to that question?
Yes, ma'am. After we had the triumph over trauma here, I really had to look at some things within my own life because, prior to that, I had took the full training with Sharice, and it was jarring up some things for me. But I have a son who is dealing with mental health, and he was adopted at a young age. And now that he's back into my life, I just didn't understand fully, not because I have other children. They're college students, graduated from college, and I have one that's in school for nursing, and not looking at the fact that it could be within my own home, but after that, and then going through the course with Sharice, and then the triumph over trauma, I really had to accept the fact that it is in my home. Not only did I have mental health that mom then brushed under the rug and said it's going to be okay, but I was doing the same thing that I was taught to do, and breaking the cycle of allowing it to be what it is and to try to seek help. That it gave me a different, sense of understanding. There's different types, and people act out in different ways because of it. My son wasn't wanting to accept the fact that he had a mental health issue, and none of his sisters and brothers, because the popularity wouldn't be there, or society wouldn't accept him. And I had it really looked at me in my face, and it made me look at it for what it was, and it changed my whole perceptions of it, because I want to save everybody else's child, but I don't want to sit here and save my own, and accept the reality of what's really going on with my own son. So now, I've taken the opportunity to go to meetings with him. I've taken opportunities to sit in groups with him if that's what he wants to do. Today, he wants me to sit. Tomorrow, he might not want me to sit. And I allow him to know that it's okay. He's 24 years old, and I want him to be able to be okay with himself. And if mom doesn't accept it for the reality of it, then you know what? He's not going to accept it, because he's following my beliefs. If I feel, and that's why it's so important for me to get out here in our communities to allow people to know, it's real. Not wanting to accept it, because for so long, and for my life, for so long, and even in my upbringing, that was nothing that we talked about. Them conversations we do not have, and I didn't know that I didn't know I taught my children the same thing. So now that I taught them that, I want to unteach them something different. And I bring my children into the communities with me, doing the work that I do, to allow them to know that they're not alone. I let them in my life for real, not just what I want them to see, and allow them to know that there is help out here. I allow them to know that, it's not only just him that's dealing with these things. It might be some of your friends that might have these situations, and then you can bring them, and we can talk about it. I do a lot of pizza nights with my kids, even though they're grown. I still, want to know, you guys okay? I ask my children, how do you feel today? I got a granddaughter, peer pressure, trauma over trauma, and trauma informed has taught me to listen, not listen to what they say, but just listen to what they're saying. And it's a big difference, you know, because I can rehearse something and it'll be something my friend said or something, you know, I want to mimic them to make you think I'm okay. And in the long run, I'm really hurting and I'm really suffering inside. You know, so yeah, it's taught me a lot, and not only in my community, but in my own family.
Yeah, and with our own selves, so many of us
Yes.
for these reasons. And you bring up something I think really important, that I think we are shifting our focus into the concept of healing rather than just controlling behavior. You know, people are in pain, and a lot of this comes out of that experience of pain. So how do we use what we know to look at healing? And the other big thing, one of the reasons we are feeling that faith-based communities are so important is through the work we've done for years and years. We know people have to feel forgiven, because oftentimes when we have addiction or whatever it might be, we do things we're not proud of. So that whole concept of healing and forgiveness is something that takes place in community, not as much in a clinical setting, right? Not as much in that mental health setting. That's why not that that isn't important, whatever, but it's that those community programs and the faith programs can really help the issues that you're dealing with your kids in a non-clinical way.
So I'm looking at the time. Sorry.
I want to answer a question from the chat. That's a follow-up question. And so the comment is, many of us have found the mental illness label very problematic. It assumes the biomedical mindset of disease to be the reason for distress, when many of us have gone through all kinds of very real trauma. The question is, which faith communities respect this reality, that we are also people who reject the DSM mindset, see the power, threat, meaning framework for a deeper explanation?
That's beautiful. I'm jumping in. I'm going to. Thank you so much. I'm grateful for the question. Yeah, so when in talking in my faith community about mental health, we've got terms, we've got language that is never going to be found in any DSM model, right? They're touched, right? It's they just got something going on, right? It's just like it's okay. That's just who they are. Like all of the language that doesn't really communicate what's actually happening with the individual, so it gets glossed over or not acknowledged in any way, shape, or form. And you're asking what faith communities respect this reality. My answer to your question is probably very few, because we have to train them to respect this reality. And that's hard work. It's such hard work, but it's so important and so meaningful to be able to give language that we are coming into ourselves, to be able to share that language with other people, so that then you have, and Netzer, we focus on this phrase as our foundation. Community is built with common language first. If you don't have common language, you're not talking to each other in the same way. So when you have that language, then now you can take that language and you can use it for the benefit of everyone, at least coming to the table with an understanding of the basics. And from there, we can build upon that learning for the benefit of practice being enabled, so that culture can then be created. Does that make sense?
Can I jump in here?
Yes.
Okay. Also, I would take this, Chaplain James, I would take that a little further. You shouldn't look for the religion to do it. You look for the innovative person within the religion. That's what you should be looking for. Thank you.
That's important, because changing religion takes generations, right? But yeah, working with the innovators, we can see change come more quickly. Okay, so I'm noticing the time. We've got about 10 more minutes, so I'm thinking maybe 2 more of these style questions before we go on to the open questions. So this one, I'm going to start out by directing this one to Sharice, which is great. You didn't get a chance to respond to that last question. What is a well-grounded theological perspective on forgiveness? Forgiveness can be a difficult thing. People end up thinking, oh, if I forgive, that means I'm saying that this person could just walk all over me. So share your insight, Sharice.
So, as a Christian, forgiveness is a requirement for me. And when I process through my understanding of what forgiveness is that we don't, well, before I say that, I don't think we do a great job with helping people understand what forgiveness means. Because forgiveness, people typically understand forgiveness to mean that, yes, you've done these horrible things, and now it's okay for us to have a relationship. I've forgiven you, and now it's okay for us to have a relationship. But that's not what forgiveness means. Forgiveness is for you as the individual. And forgiveness simply means that I'm not going to allow your bad decisions, your bad behaviors to continue dictating my life. In no way does it mean that we have to reconcile. In no way does it mean that what you did is okay. It just means that I do not wish to carry the burden of your behaviors. And it is a journey. It's not easy. It's not easy to just say, it's easy to just say, I forgive you, but it's hard for that forgiveness to take root inside of you. And it's okay that it's a journey. Some days you're able to move quickly in that process, and then sometimes you're not. Sometimes you're really struggling with how do I do this? And all of that is okay, because forgiveness is for you, and it's necessary on the journey towards healing. And if in the moment you're not ready to forgive, you say, no, I don't want to forgive. That's okay too, because forgiveness is for you. And it's when you're ready to take that journey toward letting go. And if it's not today, that's okay. I have been in places where I've had to forgive people. They didn't even know they were forgiven, because I did not begin to have a relationship with them or reconcile that relationship until years later, because I wasn't ready to go into having a relationship. But I had to let the burden of their bad decisions go so that I could be healthy. Because if we pay attention, the person who has hurt us has typically moved on with their lives and don't even care that we're here struggling. So the burden is left on us. So I always say it's a journey. It's a process. It's optional. It does not erase boundaries. If you do not want to reconcile, you do not have to reconcile.
Thank you, Sharice. Yeah, I was just thinking that forgiveness is a great diet plan, because you lose so much weight when you forgive. You do, because it's like, okay, you're carrying the stuff, and then the other person who's harmed you isn't feeling anything at the moment. You're still carrying the baggage. And yeah. So Sharice, I have one more follow-up question to you, and then we'll open it, the same one, to the other guest. Can you talk about shame? Because shame and forgiveness really go together.
So when I think about shame, shame is what happens when we've experienced severe trauma, and we're in a space of blaming ourselves for what we have experienced, for how we have experienced it, how it is affecting us. We place this blame on ourselves that is not our blame or shame to carry. But we do, we question, I must have done something wrong. Maybe if I hadn't went here, maybe if I hadn't went there. And so we carry these feelings of worthlessness. I'm unlovable. I am, I'll never be able to have a healthy relationship. I'll never be able to be okay because of these events that have affected us for a long period of time. And so as we begin to understand how trauma impacts us and what this shame is that we are carrying and how it's keeping us from even being able to develop healthy relationships with people, we can begin to heal. We can begin to forgive. We can begin to walk authentically in wholeness and be healthy.
Thank you. So we've got just a few more minutes before we go into taking questions from all of the people on this call. So for those who are not on our panel, if you want to go ahead and post your comments or questions, if you want to come online and speak your question, you can do that as well. But for the additional panelists, for Arsenio and Pastor David, out of these last two questions that I've asked Charisse, do either or both of you want to respond to those?
I think I'm okay. I think we should go to give the audience some time. I feel like Charisse did a fabulous job.
I feel the same. Good job, Charisse.
Good.
Thank you.
Hi, Neely, it's Raul. I just want to add to what Charisse talked about. I think it's so important to identify that shame as one of the significant contributors to social isolation.
Mm-hmm.
As we're talking about this, and really the need for that forgiveness, grieving, and healing, for us to be able to get back to that social connection.
Yeah, absolutely.
So important. Yeah, shame makes us hide from ourselves and from others.
There's a question.
And you know why I think it's so important? That's why we look at some of our practices that are written in stone. Everything from, we've heard from folks who have been in the drug courts that when you get up and the judge is on the microphone and the whole courtroom hears what a screw up I am because I had a positive urine, the only thing I know to do is use in order to keep from feeling that shame again. So what this also causes us to do, I think, is really think differently about some of our good intention practices that might be shaming people over and over again.
Yes.
Yeah.
Pastor David, you started to say something.
I'm sorry.
No worries. That's good feedback. Thank you, Joan. There was a question in the chat that I think goes along the same lines as the conversation we're having. Donald asked about the LGBTQ plus community and how the struggle exists between that community and the evangelical Christian community. And are there any ways to sort of bridge the gap between the two? Candidly, very candidly. I was raised by a mother who had a 30-year same-gender loving relationship that was hidden from everyone because she felt as though she was going to be excommunicated from her church. And the church was so important that that was something that she felt like she needed to hide all the way to the point of death. And it's hugely impactful simply for the protection of her own health and community. But it was extremely damaging for the same reasons. And so being able to, my passion in working to find space where everybody can just show up authentically comes from me watching that struggle with her. It's really important to see, for me, to see where people are not able to show up authentically and be loved for who they are, So it's for me, it's not about the LGBTQ plus community or about the faith-based community or about evangelical this or whatever. It's God created each one of us in the image of God. And as such, we should be respected and responded to because of that image being born on our person. Makes sense? Now, that's beautifully said, right? But it's so hard to live. It's so hard to live. And so being able to figure out how to get everybody to that place is the work that we're engaging in right now. So.
Yeah.
Thank you, Pastor David.
I saw a question also earlier, and I'm not sure if everyone can see it. And it was geared for Arsenia, and it wanted to know, how does your training, the Suicide in Black Church, differ from mental health first aid training? I'm assuming that. If I'm incorrect, Elsa, can you please correct me?
Sharice, I had spoke, I had answered her, and she was
Okay.
basically asking the trainings of basically doing the mental health first aid in the churches and
Mhm.
what was the outcome of it. And like I explained to her, it builds relationships. It starts conversations. It teaches people how to conversate within, a congregation or even with each other, because, so many people are so used to the normal conversation. How are you doing? And the respond is, I'm great. How are you? And getting that one response of I'm not okay, and that's being okay to say.
Yeah.
In society, we can take that a long way, but being a mental health first aid adult instructor, it plays a major part in developing conversations and how to have conversations and which conversations that we take further and which ones we can close.
Thank you.
Mm-hmm.
Thank you.
I think also in looking at Shireen's question or comment that has already been addressed, I just want to add to that. She's saying, I get concerned that when the only access for churches or others to understanding distress is from a clinical diagnostic framework, it perpetuates stigma and doesn't have any other narratives available than mental illness is a biologically based brain disease paradigm. Earlier, we talked about the question, what did becoming trauma-informed, how did it shift your way of being in ministry? And I think that this question and Shireen's comment coincide, because I was working off of that framework. When I went to divinity school, we learned about the DSM, like pastoral counseling, like you got the book, you got to see it, like, okay, this is what you're going to be going out there, to serve in ministries with people who are diagnosed. And so that was the framework that I had in ministry. And I said something before about I do ministry globally. On my board of directors is a nurse, and she had been trained through the Tennessee Brain Trust about trauma-informed care. And so she came to me as a board member and just said, I've got to tell you about this because we need to do this. And so she started talking with me. She introduced me to another nurse. The three of us got together, and then we said, well, let's do a conference in Tanzania and bring people from 10 different countries there so that we can all learn about this together. And being able to learn, that was 2019 for me. So it was like my mind just exploded, because all of a sudden I started seeing people differently. And it's not about like, oh, I'm gonna, like, in my mind, diagnose them as, oh, that person must be schizophrenic. Oh, that person must be bipolar. This person must be this person must be that. I started looking at people in a different way and thinking, okay, what happened to them? And so asking myself that question and then learning about the person puts me at at a peer-to-peer level, because we all have experiences that have happened to us. But being able to learn about people in my church, we have people who are homeless. We have people who are in and out of housing. We have grandparents raising great-grandchildren, grandparents raising grandchildren. And so I'm also seeing the generational trauma that's part of that. Part of it comes from the trauma of poverty. David Smith talked about the ministries of winning wealth. And I think like a lot of this is just self-perpetuating when it comes to trauma caused by poverty. it's generational, because if you're always just having to struggle a day at a time to survive, then your body's being created for survival rather than flourishing. And so I think, Shireen, it's looking at, like, okay, those of us who are becoming trauma informed, then taking it to that next level of practice, which TAMAR allows us to do, and the friendship bench will allow us to do, and other programs. I feel like it's going to be an adaptive curve for us in bringing what we've learned in our heads into our hearts and action.
I'd like to just add to that, Neely. Thanks for the beautiful comments. I'd like to add a little bit to that, to say one of the concerns that I have in working with this new language is creating new language for supremacy. There are a lot of ways where these words can be co-opted into the haves and have-nots, the do's and the don'ts and all of that, right? One of the stories that through Winning Wealth that was most impactful to me was I was dealing with a family who literally on the brink of bankruptcy, and this man was making, I think it was 2007 or 8, he was making $175,000 a year. Was about to lose his home, had no idea. His wife literally had no clue what was going on. They brought me in, started to work with them on a weekly basis with their budget, found out that he was undiagnosed schizophrenic, right? And so I say that to say it's important for us to not go immediately to impoverished environments with this new language. It's really important for us to allow for this new language to create level ground for the benefit of all of us, knowing and seeing with this language how we can impact not the ones who are less than or considered lower already, but let's figure out how we can impact the world with what we're learning, you know?
Can I say one thing real quickly? I love that you said that. We were doing a training, and a lot of people talk about resilience. It's like the big buzzword now. And someone said to me, and I so agree with this, when people say resilience, it makes me feel like you just want to teach us how to suffer better. Think about that. And that, I think, is what you're talking about, that difference between have and have nots, because you're going to have people coming up with these ideas, just be resilient. Well, when really we should be about social justice and trying to deal with the issues that caused that trauma in the first place.
Right.
But instead we just say, be resilient. And that, I'll never forget her saying that. And then she said, I want softness and caring and compassion and empathy. I don't want to be taught how to just suffer better.
Yeah.
But may I add to that, Joan? Like sort of connected to all of it, and I appreciate Neely you saying it, and Elsa, I appreciate you bringing up the question about mental health first aid in particular. It's been a really robust dialogue in the chat about this. You know, I want us to keep in mind that it wasn't that long ago that LGBTQIA was in the DSM, that it was a diagnosable mental illness, and conversion therapy was considered treatment. When we think about what gets labeled as mental illness, it is a very westernized medical paradigm and frame of reference. When you go to Zimbabwe and you look at shamans and you look at other cultures that don't have a language called mental illness, it is viewed very differently and not pathologized. And unfortunately, it often becomes very weaponized in our society, with young Black men being diagnosed with schizophrenia at a higher rate than anybody else, with the levels of involuntary commitment and confinement that call themselves treatment, with the overuse of medication, the criminalization of what gets called mental illness. So it's a slippery slope when we start perpetuating a paradigm that is rooted in a clinical diagnostic frame of reference. I think part of what we are all here to talk about, which I appreciate the space so much for, is healing, is trauma, it's not, the labels become frankly irrelevant when you're talking about human experience, when you're talking about shame, when you're talking about guilt, when you're talking about forgiveness, when you're talking about poverty. And I'll just end with this. I've been given 8 mental health diagnoses over my lifetime. My first one was at the age of 13. And some of you know this. When I came into services at the age of 13 and I was diagnosed with a mental illness, I was experiencing sexual abuse at home. And none of the clinicians, psychiatrists, or the adults in my life looked at my behavior and understood it through the lens of trauma. They're looking for a clinical diagnosis. And so when I talk about, it doesn't have to be mental health first aid, but when I talk about that paradigm shift and how dangerous and reckless it could be to perpetuate information about diagnostics and symptoms and illness, it's because on the other end of that framework are people that are harmed in the name of what we call treatment and medical and clinical professions. Thank you.
I'm glad she said that, because I am one of those that don't look for the clinical. I have the experience. And CPRS is here in Tennessee. We use our experience to help guide into treatment or into some kind of, help for the issue. We don't come with a diagnosis because we all are in lived experiences. We all have come through to a point in our life that we have accepted the fact that we have an addiction or we have a mental health, or we're dealing with some stigmas from society, or should it be just anybody? Because it can be family, regardless of what. And one of the things that we do here in Tennessee with our CPRSs is we get down on the floor with you. You know what I'm saying? We don't try to bring you up to the logic or the explanations and all the extra things. We feel that pain because we've lived that pain, and I know when I was going through my transition, there wasn't a lot of words that you can tell me that I hadn't already heard. I just didn't understand them. Come to me before you bring me to you. That was one of my things. And for someone to sit on the floor with me and just allow me to talk or just hear me, you know what I'm saying? And hear what, I know what I'm saying, but hear what I'm not saying. You know what I'm saying? There's something going on with me, not being afraid to ask the question, Arsenio, are you okay? Or Arsenio, is something going on? Or did something happen? You know what I'm saying? Not being afraid to ask me simple questions instead of bringing me into a classroom or, some kind of group or anything like that. And that's one of the things that I lead with myself, even with the faith-based community that I deal with today. I know they rejected me because they didn't know how to handle me. They didn't know what to say to me. And they just did what they, normally do, or pray about it, or, let's go to counseling about it. And they didn't know how to counsel me. And at the end of the day, that is the strategy that I use personally, because I get that, I can be hurt while someone's trying to help me. They can hurt me worse. I'm already damaged. I don't know how I feel to be human. I don't know how I feel to be whole. I don't know how I feel to overcome. And a lot of words that people think are helping, they do harm, especially if it's a person that does not understand the logistics, that does not understand that you're really, really not knowing, and it's okay not to know. It's okay to get somebody that do know. It's okay to be able to tell someone that I don't understand, but I will listen. You understand what I'm saying? So yeah, thank you. I appreciate that.
If I could
Can I say
add
something
the
real
next
quick?
step. Go ahead, Mike.
To follow up, because I've been watching the chats, the threads, and thank you, Shireen. Thank you, everyone. But in talking about shame, and I'll keep this brief, one of the things that was astounding for me decades ago was learning in several different studies that over 90%, 93%, 95%, whatever the study, of the folks receiving services at the mental health centers have trauma. So why do we keep putting these labels and this stigma? And it's just a belief of mine, but the shame, as Shireen spoke about sexual abuse, a lot of us have physical, emotional, and sexual abuse from childhood, but we keep hearing, don't talk about it, whether it's the place we're supposedly going to get help or society does not want to hear it. That's why I'm so grateful to hear what you folks are doing in the faith community, because I can think of when I've reached out to Protestant churches, Unitarian, Universalist, or Catholic, and it's, oh, you just got to forgive and don't talk about it. You got to heal. You got to move on. You got to pray more. That's BS. That's not healing. That's not trauma informed. That's not it's so. Once again, society, I just let, society, churches, faith communities, the mental health centers, they're all shaming survivors of trauma to not talk about it. And if you put a label of mental illness on it, well, damn it, it must be your fault because your biological whatever is screwed up and it's your fault for being the way you are. So really embracing that it's the trauma in our lives, whether it's poverty, racism, abuse, that's what's driving the bus on all of this. And I'm grateful for you folks who are leading the charge. I wish you'd come up to New England and speak to more of the churches up here. Thank you.
Connect us. We'll be there. Yeah, I'd love that. So we've got a question also from Hyacinth Charles. And she says, for instance, everyone in the church isn't of Christ or seeking his face. There are people posing as Christian. How do we offer really safe spaces for people to come forward with abuse from such people and not suffer the inevitable backlash from them? Pastor David,
Yes,
do you want to address this?
Sounds like I should, huh?
Yeah. I'm going to pass that torch.
Yeah, sure. I mean, it's like Netzer, right? Another thing that was foundational in our community as we were building it was, and I apologize for the low language, but I'm going to say it like we said it to each other. You have to create room for suckers, right? You have to create room for suckers, people that have nothing to add to your community, and they're just going to suck the life out of it. You have to create room for suckers. And in every church, in every community, in every Christian organization, there are going to be just suckers of life. And you've got to allow for them to grow with the rest of the community for the benefit of them, at least getting to where we started, so that we can hopefully move forward together. I don't have an answer on how do you make a person a real Christian, because I don't know what that is, right? Yeah, sure, I pastor at a church and I'm trying to figure it out every day myself, but I've gotten to the place where people have called me not a real Christian. So I'm not quite sure how to make that definition as clear as I possibly can, so that the whole world can say, yes, that's the definition that we will support. But what I can say is, as we're all journeying together, we can figure out where most of us and or the book that we believe in, the Bible, where it differs from our action, right? And lastly, I'll say, let's not put those connotations, definitions, or requirements on people that don't believe in the book that we believe in, right? Like it, yes, sure, absolutely. It's really important for us to have common language and understand, to create room where people are actually not interacting in a way that adds value to the community. But that's okay, because maybe they just can't. And maybe because they can't interact in a way that adds value now, maybe 10 years from now, you're not going to be the one who can interact in a way that adds value, because you've not grown with the community in a way that will help you be the person that is laying new foundation, and you'll need to lean on that individual. So I offer that there are a lot of definitions of what this will look like, and the ones that are least accepted at present are probably going to grow into more prominence, because one of my phrases is the church is a lagging indicator of social change. We're always last where it comes to any real promising change. We're a lagging indicator of social change. So if the church is getting it, I think it's promising that the rest of the world has already gotten there maybe 10 years before.
So I want to just add to that, because I think too that what is being asked is, like, how do we offer safe spaces for people to come forward with abuse from the posers, and not suffer the inevitable backlash from them? So one thing that I know has been done over the last 20 plus years are programs that actually came out of the abuse that was surfacing and coming into the media that was happening within churches. And so insurance companies started driving that conversation because they said, basically, you've got to be able to show your policy on protecting people, vulnerable people, both children and vulnerable adults, from abuse within your religious context. And so I was a part of my local church. When that first came out, it was called Safe Sanctuaries. It's still in operation, but those are best practices in creating safe spaces within a Christian environment. Islam and Judaism also have guidance around that, but there are, there's a framework now. Here's how you can prevent abuse. Here's what you do when it does happen within your congregation. Here's what not to do. And then for the person who is suffering, like, how does your community then surround that person with a community of love and not isolation and shame? So those are some of the things that are happening now currently. And not everybody will practice it. Not everybody will practice it perfectly, but the person who has been abused must be heard and respected and honored, and then protected from backlash. And it can create infighting because people don't want to believe that someone that they have adored as a religious leader is capable of doing something wrong. And so those are really problematic. But I mean, the best thing is for us to get ahead of it and protect people. And we've all got to be in on the protection of people. It can never be delegated to just one person's job. It's a whole community's job.
Yeah. And I'm sorry, I missed the abuse portion of that question.
Okay.
In policy, we at our local church, we have a requirement for anyone who is serving to do background checks and child abuse clearances. We created opportunity for any individual to report if they feel as though they've been approached in a way that puts them at risk of feeling uncomfortable. And as Neely said, it's very, very important to not victimize the victim. Being able to create culture around that, though, again, is very hard work, and ensuring that the one who needs the care gets the care, and the one who needs the consequence gets the consequence. That's the hard work of leadership.
Yeah, I know. I grew up Catholic in high school in the 70s in Baltimore. So believe me, you get that. But I just wanted to add just real quickly, one of the things that we've done with this with this project is provide concrete things that people could do. That's the TAMAR program. So it doesn't become this, just ideological thing. As you have NA groups and AA groups in places of worship, the TAMAR groups will be offered in the same capacity. So we're offering the communities, not just we obviously want to change the culture, but offering people the opportunity to get those groups to be able to feel healed, to be able to feel supported, to get that peer support within the churches, using the space of the churches to do that. So we're offering people free training twice a month on how to do the TAMAR groups. We're offering the manuals for free. All of it costs nothing, and it will be able to get the places of worship to start doing something rather than just talking.
Yes. We could go on and on. We've got 6 minutes left, and I do just want to say to Sandy, thank you for that comment. Has the larger faith community addressed church-based trauma, how they dealt with church members' suicide, substance use, PTSD? I can personally recount a time when the local congregations that family members attended rejected them, stigmatized them. These occurrences leave deep scars. They do. They leave generational scars. And there's some really bad theology out there that is sometimes perpetuated against people when they are suffering their most. And it's deeply flawed. And so, so these are things that we have to, as leaders of faith, like, we've got to continually be challenged, like, to do things well, to keep learning, to do things better. It's a cycle that we've got to do, and we've got to continue our education until we pass on to the next life. So let's see, 2 more messages. Let's see, we've got this, and then we will close out. I think that the church needs to remember that Mary Magdalene, who was possessed, in quotes, ended up being one of the greatest, most ardent Christians of the early Christian church. That term of possession mostly lacks, oh, sorry, this is not showing up in my browser quite right. Most likely include persons, include some MI, mental illness. Shouldn't the church recognize her effort and faith as noble, and one implying a good faith and therefore to be respected, and as an example of an accepted brother or sister? Amen to that. And I do want to say that the work that we do in the church, it cannot just be one thing, cannot just be another. It's got to be fully integrated. Trauma-informed sermons, trauma-informed care and practice in meetings. It's got to be in everything we do. I want to leave the last few minutes for our panelists, Pastor David, Arsenio, Charisse. Any closing remarks?
I'll close with this. And first things first, thank you very much for the invitation to be a part of the panel. I'm grateful and appreciative. This is a very enriching conversation. I learned a lot from it. So thank you very much. My closing thoughts are from my thinking about the work of Brené Brown and how it's really important for us to come together as like-minded individuals and talk about the things that we felt and we've heard and we're trying to do. But if we just talk about it amongst ourselves and we're not brave enough to take it into a culture and a context where it's going to be rejected, what good is this conversation, right? So my closing comment is, let's be brave together.
Arsenio?
I think Pastor David said a lot. Yeah, that's one of the things that I would leave with is, I mean, it's okay for us to have the town halls, but let's take it from the town halls into the communities, into the congregations, into the families, into the community, and let's spread, and heal together.
Amen. Charisse?
So I agree. Thank you all for showing up and participating in this town hall with us. We have to continue doing this difficult work. It is difficult. And we are dealing with people who are broken. So there is an expectation that we will get cut on their brokenness. So we have to make sure that we are taking care of ourselves and that we don't allow that to damage us as we are doing this necessary work. Because as I said in the beginning, healing happens in relationships and in communities. So we're doing this work together. And my final thought is for anyone who has any additional questions or comments for any of the panelists, our emails are in the Zoom, in our Zoom box where our names are. So please feel free to take that. And if we can be of any support to you as you are going out into your communities, please feel free to let us know. Thank you.
Before turning it to Joan, I'll just say thank you all for attending and remind you to go to triumphovertrauma.info. You can download the resources there. You can sign up for online groups, and you can also sign up to become a facilitator. So Joan.
Well, thank you guys.
Thank you for listening to the Women Arise podcast. If you would like more information on this 3-part town hall series led by the National Association of State Mental Health Program Directors, please visit their website, which will be listed in the information below, or go to triumphovertrauma.info and look at our special event page. Thank you, and I hope that you have a blessed day.